I wish more women would come in for that all important preconception visit, because there are so many things that I like to tell them about that I actually made my own small booklet that when somebody comes in and they are not yet pregnant, but even an iota of thought about becoming pregnant, I want them to take this book and go all the way through it. And I'm going to tell you some of the things that are in my booklet that I want people to be able to look at and think about before becoming pregnant. So basically, the best way to ensure a healthy pregnancy, of course, sounds a little trite, but is to develop healthy habits prior to pregnancy. So a healthy diet, healthy exercise routine, getting tested for any kind of infections, making sure that you're up to date with immunizations, know your family's genetic history, because it's one thing for someone to come to me before they're pregnant and tell me, I know that there are relatives on my father's side of the family that had this condition and I think I should be tested for it. It's another thing if they come to me already pregnant with that information. So also looking at your emotional and mental health, especially in these days of COVID. I have people coming to me all the time that are in need of counseling or medications or help or therapy for depression and anxiety. Those are really things to get a handle on before becoming pregnant, because pregnancy will throw another monkey wrench into those situations. And of course, things like eliminating alcohol and any unsafe or illegal drug use, looking at your home and work environment to avoid potential toxins. And I think the biggest one is make sure you have a good source of information on what to expect during pregnancy, what's normal, and when are the times that you really need to get in touch with a healthcare provider because something's not right.